Welcome, welcome to the Gorgeous Glow Skin Show. I'm your host, Dr. Sonia Johnson. So it's so good to see you guys and to speak on this platform again. And so I'm so excited. And so hope you're enjoying your day because I know here in Indiana it's beautiful outside. I know a lot of people are still getting used to the changes, and definitely some are flying out the doors, which I understand. It is so beautiful. So definitely enjoy. I'm hoping you're enjoying your days, the sunny days that we're having. And so, with that in mind, I'm just going to wait on some people to join us. And so, I'm hoping people are getting some normalcy in their lives. Is it back to baseline? Maybe not, but that's okay. This is where you get to recreate your life and what you want for yourself. So, well, let's get started here. Again, I'm your host, Dr. Sonia Johnson. Welcome to the Gorgeous Glow Skin Show. I'm a board certified dermatologist, creator of the Gorgeous RX system, as well as a best selling author. Again, I help women who want to have even and clear skin tone with increased confidence. With the use of my books, lectures, as well as products, I can help you achieve that look you're wanting to have with increased confidence. Great. So today we're going to talk about melasma. This week alone, I've seen a lot of women who are coming in and want to get treatment for their skin discoloration. And what they're noticing is, and I don't know if it's due to the increased sun exposure, but they're noticing a mustache. That's the main reason why they're running in, because they notice discoloration on the upper lip. And it looks like a shadowing effect, but really it's just increased pigmentation. Some, of course, have it on their cheeks, as you know, but it's bilateral. So only on the upper lip that is, in a sense, is really not bilateral, but on the cheeks is bilateral. Temple area, the same thing. They're noticing increased pigmentation. And I'm seeing a lot of women, for some reason, who also have it on the forehead, right here in the upper center area of the forehead. So really interesting, because normally, like I said, melasma is a bilateral presentation of increased pigmentation. So what is the cause of it? I have a few women that my concern was, especially when I saw the discoloration in other areas, but it was, again, symmetrical. It was just very extensive. I was questioning a drug eruption. Was it medication they started taking? And with the increased sun exposure, they noticing increased pigmentation on their face. But that was not the case. And usually with the drug eruption, you have some type of symptoms, irritation such as itching or burning or sensitivity of the skin, but that was not the case at all. So with that in mind, I'm back to melasma. And so with that, like I said, you notice an increased pigmentation in certain areas. Now, the reason for melasma is there is alteration or changes in hormone, basically. And you see that in women. So it could be the start of birth control, change of birth control, the stopping of birth control. Heaven forbid is due to starting menopause, but mainly is a change in your hormones. Now, there's also that hereditary component, and that's where not only women can get that from, of course, family members having the same condition, but males. So this is common in males too. I do not want you to think this is just a women's problem. No, a woman problem. It can be a male problem also. Normally I see it on the temple areas of males. So really on the sides here, very dark, increased pigmentation. But like I said, I mainly see women, but I'm seeing women who have it more so presentation on the upper lip, which is common with melasma, and also in the center of the forehead, where we call the glabellar area. So this is another common site, I know, for this week anyway. But so I talked about the reasons why you can get this problem. And another fancy word, we call it the mask of pregnancy for women who notice increased pigmentation while they're pregnant. Okay. So that's just a little terminology that, we use for melasma during pregnancy. So how do you treat it? What caused it? We talked about what caused, but why? Well, we don't know. It just happens. And I can say this time of the year is Of course, the time where it comes out full force, but this is the worst time because you really are fighting against the sunlight. The sun will make it worse. So, how we treat it? One, sunscreen. You definitely want to block the sun. And when I say every 2 hours, you put on, reapply that sunscreen, you want to do that because it will get worse. Even when you're working really hard at it, using products to get rid of it, as well as blocking the sunlight from, touching your skin, it still will may stay. You may still notice it. It will not totally go away during this time of the year. It normally totally goes away in the wintertime or the fall when the sun is not really so pronounced. However, you can work at it, but a lot of the work is going to come with reapplying the sunscreen. So you want to make sure you do that when I say every 2 hours, that's being really generous. So the problem is if you wear makeup, you can get sunscreen. First of all, you can put your sunscreen on and then get the sunscreen in your makeup. However, that doesn't last all day long. So that's the downside. But if you do not wear makeup, then yes, look at the sunscreen you're using, and you want to see how long does it last. Normally sunscreens will last 30 minutes for regular sunscreen. The ones that are sweat resistant or waterproof last about 45 minutes. And then there are some now that are sweat resistant or waterproof that are lasting actually 80 minutes. Get that one. so you don't have to put it on every 2 hours. But I highly recommend that wearing your wide brim hats, trying to avoid the direct sunlight between the times of 8 to 3. And, so you do your activities before the sun or even after it goes down, but still wear your sunscreen. And even if I hear, oh, I don't go outside. You walk by the window. So you want to just get in the habit of putting that sunscreen on as often as possible. Okay. So that would definitely is your number one treatment for melasma. It would block the sun because otherwise all the efforts that you're going to put into trying to clear that discoloration goes out the window. You will be wasting your money if you do not apply that sunscreen and, really try to protect your skin from the sun. Another broad category besides sunscreen is, of course, bleachers or brighteners. And we will definitely go more in detail with that next week. But, you're looking at your kojic acid, your alpha arbutin, your hydroquinones, and for people who don't want to use hydroquinones, again, there's the kojic acid. There's a glutathione, another medication, tranexamic acid. These are all bleaching products or brightening agents that you can use, and they do work. So again, if you're going to take the effort and spend the money to apply those products as indicated to get rid of the melasma or to try to subside it, then you definitely want to wear your sunscreen. Okay. Now, another thing is there's a red component to melasma. So we mainly see the discoloration, and that's what I mainly see. However, there's also a red component. So when you get to the point that you're trying to clear it up and you notice that it won't budge anymore, then you need to take care of that red component. Okay. The red component you can use, I like Mederma. Mederma over the counter is an option. But of course, laser for dilated blood vessels. And that's where, so that's something to consider, getting laser done. And also you can use laser for the increased pigmentation aspect too, which is the IPL laser. So, laser is another category to take care of both aspects of brown as well as the reddish component of melasma. And then there's the exfoliators, products like your adapalene that you can buy over the counter, but also your retinols that are over the counter that I think do a better job. And then there is, of course, Retin A, which is a prescription vitamin A product. So those are your big categories. Like I stated, sunscreen, your bleaching or brightening products. And of course, in those brightening products, you want to include vitamin C, very important. But also there is lasers, and then there is your exfoliators. And then there's something for the redness, which I call Mederma. That's my favorite. That's the least expensive product that works for redness. So next week we're going to go in detail about the blenders or the brightening, or another name for it is your bleaching products. And just to talk about, so you can get educated on what to do and what your options are. Otherwise, any questions? Okay, great. Well, again, thank you for joining me. Wear your sunscreen and wear those wide brim hats to protect your skin. I'm your host, Dr. Sonia Johnson, board certified dermatologist, creator of the Gorgeous RX system, as well as a Amazon bestselling author. I help women who want to have even and clear skin tone with increased confidence through the use of my books, lectures, as well as products. Below on the crawler, you can see the GRX box. That's the system that we sell, and that does include some of those products from the different categories: your exfoliators, as well as your sunscreen, as well as your bleaching products. So that covers 3 of the 5 categories I mentioned that will help you with your melasma. Otherwise, you can go to the website to our Gorgeous RX store. As you can see the crawler at the bottom, GORGEOUSRX.com, to buy other products. And if you're interested. So thank you again for your time. And I will see you next Tuesday. Take care.